I think the scariest part of my whole journey was that heart attack in Greece.
Katrina Berry never saw it coming. A healthy person her whole life. At age 25, she was now gasping for air, feeling a weight on her chest. Katrina knew she had to fly home immediately.
I go directly from the Logan Airport to Brigham and Women's Hospital.
There in the ER, a CAT scan revealed a horrifying problem.
They found dozens of blood clots in both lungs, causing very severe heart damage. It looked like the doctor had seen a ghost.
Katrina received treatment for the blood clots, but her shortness of breath continued to get worse. That's when doctors decided to take a closer look at her heart. Their diagnosis was devastating. Katrina had pulmonary arterial hypertension, also known as PAH.
The doctors told me straight up, I don't recommend Googling it.
PAH is a rare but often fatal disease where blood vessels in the lungs become narrower, blocked, or destroyed. That slowed the blood flow, forcing the heart to work even harder.
Pressure starts to build. It builds backwards into the right side of the heart. The right ventricle starts to dilate, thicken, and start to fail.
Dr. Aaron Waxman runs the Pulmonary Vascular Disease Program at Brigham and Women's Hospital. He's also Katrina's doctor.
Pretty much any activity she did made her very short of breath. She had some findings on exam that suggested her right heart was very dysfunctional, if not failing.
Katrina had heart surgery and went into cardiac arrest and then on life support. Somehow she pulled through, but learned recovery would include oxygen tanks and complicated treatments to keep her alive.
I was 25 years old and I could truly feel myself dying and my body giving out on me.
Dr. Waxman suggested joining a clinical trial for a new treatment from Merck called sotatercept. The drug is designed to capture proteins in the bloodstream that can cause the blood vessels to narrow. Katrina felt the difference within months.
I noticed significant improvement. I was able to do more. After 9 months on sotatercept, I was able to come off of oxygen.
Dr. Waxman says other patients in the trial had similar success.
And I think the most important thing I've seen with this drug is normalization of what's going wrong in their blood vessels of the lung. People probably wouldn't recognize these patients as having a disease. And now we come along with this, essentially make their lives a whole lot easier and simpler.
For Katrina, it's been a miracle that's meant skiing, swimming, and traveling again.
Being able to get back to the old Katrina and get my life back.
Wow, that is scary, but also very promising.
Absolutely, and she was only 25 when this happened, so can you imagine? Now that phase 3 of the trial is complete, the data for sotatercept heads to the FDA for approval, and since Katrina was enrolled in the trial, doctors say she can continue taking that drug, but other patients with PAH must wait.